This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits via online course modules. To access these and for more information, visit our website at www.emergencymedicalminute.com/CME-courses, or simply click on the link in our show notes and create an account.
All right. Well, good morning. I'll make this kind of quick, but I don't know if anybody's been listening to some of the talk about ivermectin for COVID. You know, obviously now we're all talking about vaccines, but they're still trying to figure out treatments and trying basically, it seems like any drug that might potentially be an option. So ivermectin is an antiparasitic medication. It's been around for a long time. And for some reason, they started noticing that maybe it has some anti-inflammatory, antiviral properties. So there's actually been quite a few studies kind of internationally over the last several months, some in the United States, looking at ivermectin. And some people apparently feel very passionately about its use in COVID. So there's a little bit of a controversy over whether it should be used now or not. So some of the studies that kind of sound good in the lab, it's been shown to decrease how quickly COVID replicates. Maybe it makes it less likely to actually kind of attach to cells, so people are less likely to get it. That's looking at it in the lab. Studies have shown that in countries that actually use ivermectin prophylactically, there's lower rates of infection. They've studied it in both inpatient and outpatient settings, and some studies suggested lower rates of worsening of disease, lower mortality rates. There was a study in Florida that was done that kind of got a lot of people's attention that showed that people who got ivermectin tended to have, again, lower mortality rates. But all these studies were low quality studies. They weren't true randomized trials. There was always kind of confounding. Patients got more steroids in one group. Patients were different kind of demographics. So recently, just a couple weeks ago, the NIH kind of weighed in and said that there's not enough evidence to support or refute, so like not enough evidence for or against, and definitely the recommendation for most people is that we need more trials, good trials. We all know hydroxychloroquine and lots of things have been tried in COVID that looked great at first in small studies, but then when actually big studies that were well done did not show that something panned out. So it's possible that this might be useful, but if patients ask for it or just for us to know, there's probably more studies that need to be done before you can really know whether ivermectin will work or not. So that's where it seems to be.
The Emergency Medical Minute would like to thank our sponsor, Swedish Medical Center, for helping fund our nonprofit organization and make this podcast possible. Donations are essential to our organization to cover operational costs and fund the creation of our online courses offering AMA, PRA, Category 1 credits. So if you enjoy our show, and if you're able to make a one-time or recurring donation towards our organization, any amount is helpful. Please click the link in our show notes to make a donation. Thank you for listening.